Hey guys, Lori here, pharmacist. So I've been going back and forth with this doctor, and it's gotten pretty hilarious to me. As this person has sent me articles that started out with measles epidemics in the 15 and 1800s from the Hawaiian monopoly that got wiped out and the Incas, and I'm like going, are we really this archaic in our thinking that we're tying measles epidemics back then to what's going on now, to the a little over 1,000 cases in New York, which when you look at a population of 300 and over 329 million, just do the math. What can I say? But anyway, and I'm not saying that the measles isn't highly contagious, but my point is, we have clean water and sanitation. And then he had sent me another email back that said something about, do you really want us to become a third world country again? I mean, I'm not lying, guys. I almost lost it. I was like, are you kidding me? I didn't see the email for a day, so I didn't respond. But when I did, I was like, are you serious? Are you insane? Is your head so in abstracts that you can't even look at history and see what clean water and sanitation did between just even 1900 and the 1950s? And this is what gets me, is just the narrow-mindedness, the in a coma, the so indoctrinated by the pharmaceutical industry that, I mean, some MDs cannot even begin to grasp anything outside of their pharma box that they've been living in for so long. And not only in the course of the emails was it this kind of thing with this doctor, but no compassion. Just no compassion for people. And that's, to me, where did you leave your heart? What door did you check it out at, and how long have you been checked out? I just don't even understand. I mean, even if you said, hey, it wasn't the vaccine, or I'm not sure it was really the vaccine, I'm going to have to read up on that to have no compassion. I sent him a link to, actually it appeared on my Facebook feed. It was a girl that is in the UK, and she went seriously downhill after the Cervavix vaccine that she received. I think the first dose she was doing okay, but then after the second dose she really went downhill, and the third dose sent her over the edge, and she has myalgic encephalomyelitis, which he consequently told me was not even a diagnosis. And I'm thinking, well, there's a lot of doctors prescribing medications on that not a diagnosis, which is related to chronic fatigue, and then you have things like Lyme disease. But bottom line, folks, is we've got a whole host of neurological diseases that have presented and increased so rapidly since we've started the adult vaccination program of the flu shot, the pneumonia shot, Tdap, shingles, and all these things, injecting these toxic chemicals into adults. And I can tell you, back working as a retail pharmacist, that I used to think, what is wrong with these people? When, they'd say, well, it's fibromyalgia or chronic fatigue. And, there was kind of a part of me that was like, are they hypochondriacs? But yet they had real pain. I mean, they did. So where is that coming from? And now that I put together what I have with vaccines, I'm like, well, all the pieces of the puzzle are kind of starting to fall into place and starting to make a little bit of sense. But when you're like this MD that says, oh, these chronic diseases are all just neurological, psychological. He didn't say psychological. He said neurological, immunological. Oh, there was one other adjective he used. There might have been two more, but the point was, at the end of the day, this isn't really happening. I had sent him the audio off YouTube of Christopher Bunch's parents at the ACIP meeting last October, reading the testimony about their son and what had happened, and then reading the letter from the neurologist, which Christopher died of ADEM, acute disseminated encephalomyelitis. And, that's exactly what the neurologist ruled it that the vaccine had to be considered, since this had been seen with this vaccine and he had had the vaccine a month before. And this doc comes back and says, oh, you know, it's just a sob story, and something about viral encephalomyelitis. And I'm like, did you not listen? I don't know, he said he did, but then his reply, then he sent me some links to abstracts that had, where they had actually studied and seen the ADEM from the vaccine, which I posted. And so, you know, I guess if it doesn't appear in an abstract, it's not legit, guys. But anyway, and why am I telling you all this? Because I want you to understand the mentality of so many medical doctors out there, and why you have got to think, you have got to question, you have got to read, you have got to research on your own. Because here's one of the things that I cannot stand about Western medicine. And that's one of the things I said to him. I go, oh yeah, that's right. You've only been trained in Western medicine. But if you start looking at acupuncture, homeopathic, naturopathic, not only do those modes of medicine and healing embrace each other, they also, to a degree, embrace Western medicine. They never say, oh, we've arrived, we've got this, we know it all. Whereas Western medicine goes, no, we've got this, and anybody that doesn't go along with our program is either a quack or irrational, emotional, basically a crazy person. What kind of thinking is that? It is so narrow-minded and supremacist. I mean, and yet what has Western medicine done for us? How sick are the people? How sick are the children? Does a prescription drug cure anything? No, it never has, and it never will. And so why do these Western medicine people think they have arrived? It's like years ago when I had a horse that had cancer, squamous cell carcinoma. I ended up taking her to a homeopathic vet because I knew radiation or chemo was going to just kill her dead, not to mention cost me God only knows how many thousands of dollars. And I literally watched this gaping squamous cell carcinoma, which was growing bigger and bigger every day. I worked with this, actually she graduated from University of Florida. She had a traditional veterinary medical license, but then she went on to do acupuncture and homeopathy. I mean, what a brilliant, incredible woman. What a place of healing this was. And I take this horse down there where she works with her. I'm going to make a video just about that because it was amazing. And then one day, about a month or a month and a half later, I literally watched this cancer heal, like as if it was a cut or a skint knee or something. It was amazing. And this horse went on to live another 10 years. So like, you cannot look at me and tell me Western medicine has it all, because not only do I see how sick the people are, how sick the children are, I also see it curing nothing. We're not healing people. We're just prescription on top of prescription, Band-Aid on top of Band-Aid. And like, what was the post that I reposted that says, ask your doctor if that drug with 32 pages of side effects is right for you. I mean, that's really what it boils down to, and I don't know, people. But anyway, I want to encourage you. I want you to be strong. I want you to learn to question. I want you to take a stand. If you need my help, if you need my advice, I'm not afraid of these people. And yet people like this, MDs like this, treat another medical professional like me with no respect, as if I'm a completely crazy person. Because I think outside of the box, and I've educated myself outside of the box. And I'll tell you something else I told him. I said, I'm just trying to help you wake up from the coma. But you know what? I think he's real comfortable in that coma. I don't see him waking up. And here's my thing. You can learn the truth in this life, or you can learn it in the next life. But eventually you're going to learn it. And the truth will always be known. So anyway, love you guys. Like I said, I'm here for you. Any questions, anything, I'm here for you. Take care. We'll talk soon.